We are very, very honoured to have present with us a panel of esteemed doctors from the Muslim community throughout Australia. We've got people present with us here today from Sydney, from Melbourne. We've got an apology from Queensland. And so, it's a great pleasure to be able to welcome such an esteemed and distinguished set of people from our community who really are qualified to speak on this particular issue. So before I introduce each of our panelists, I just want to say that we will have an apology from Dr. Ghulam in Queensland, and we again want to acknowledge that our community in Queensland is also going through fresh challenges today as a result of a new outbreak there, and he had to be deployed to that particular outbreak, and it just shows you that there are people from even the Muslim community who are very much at the coalface of this. Now, before I introduce each of our panelists, I just want to acknowledge the interest from the community in today's live stream. We've had a lot of interest from all quarters. We've had interest from the media who are interested in seeing how the Muslim community is dealing with this particular issue. We've had interest from overseas, doctors and sort of ordinary people contacting us and saying what a great thing it is that's being done to address this particular issue head on. So thank you very much to everyone for their encouragement and for joining in today. Of course, the stream will be available after the fact. So if you want to share it with your friends, family, etc., please by all means do so. And without further ado, I'd like to introduce our panelists today, and then we'll get right into the questions. So we've got, as I said, a who's who of doctors and specialists from our Muslim community, from the medical profession. We've got Dr. Fariha Dib from New South Wales. Dr. Fariha is a local community GP who's involved in the COVID-19 vaccination community centre and provides counselling to community members on the COVID vaccine issue. We've got Dr. Faisal Chowdhury from New South Wales. He's a respiratory and sleep specialist. He's at the front line as a COVID-19 physician who is currently involved in acute COVID-19 management at 2 tertiary hospitals in Sydney. He was also part of the hospital committee for devising the non-invasive ventilation guide for COVID-19 management. We've got Dr. Ashraf Shahata from Victoria. He is an orthopaedic surgeon. Dr. Shahata is the Vice President of the Muslim Health Professionals Association of Australia. He has a special interest in vaccines from the time of the Ebola virus and the vaccine developed for that in the 90s, and has provided advice to various peak Islamic bodies when it comes to the COVID-19 issue. We've got Dr. Fatima Ashrafi from Queensland. She's a obstetrician gynecologist. Dr. Ashrafi sees women from childhood, adolescence, reproductive life, and beyond menopause. She was recently appointed the AMA Queensland Councillor and is currently the president of the Islamic Association of Queensland, IMAQ. Finally, we've got Dr. Abdul Latif Halimi, who is a doctor who's currently working with Western Health in Melbourne, including as a medical officer at several vaccination hubs. So he's very much at the coalface of the distribution of the vaccine. And it'll be great to get his perspective today as well, inshallah. So without further ado, we're going to make a start. Again, thank you so much for everyone who is joining us. We've got very strong numbers on the live stream, which is great to see. The way that we'll run today is there are a set of questions that we've received from the community that we will run through, and I'll address those to one or several of our panelists, and we'll go through that one by one. And then we're keeping a very, very close eye on the live stream feed. We do want you to come forward with your questions, so please do, and we look forward to putting them to our panelists either throughout the live stream or at the end of the formal questions that we've pre-received and written up for them, inshallah. So without further ado, let's get on to it. So we've got the first question, and I'm going to start with Dr. Fariha Dib, inshallah. Dr. Fariha, let's start with you. Now, some people ask, is COVID-19 that serious? Let's begin with this question that I'm sure all of us have heard. The mortality rate is very low, and most people who die are old or have comorbidities. They have other conditions. How would you go about, Dr. Fariha, responding to this particular question?
Assalamu alaikum, Brother Faraz, and thank you to yourself and the other panel members and everyone from our multicultural community that's taken the time to join us in this live streaming session. So COVID-19 is very serious. I think most people are realising that now. We are experiencing a global pandemic, which is unprecedented in many ways. The physical, the social, the psychological, the financial, economic impacts have been devastating. If you look at the most devastating result, it's been the loss of 4.25 million deaths worldwide. Many of our multicultural community members listening today have had multiple family members that have passed with COVID overseas. COVID is likely to be 10 times more deadly than the flu. So it is very, very serious. Yes, you are correct, Brother Faraz, about the elderly and those with underlying medical conditions being more at risk of serious COVID-19 infections. However, COVID-19 also very much affects younger adults with no pre-existing medical conditions. Look, in Australia, we've been very fortunate with low death rates so far. That means that we are, it doesn't mean that we're not at risk of developing in catastrophic situations like we've witnessed in India, Indonesia, and many other countries. In Australia, we've had the benefits of early physical distancing measures, the high per capita testing rates, we've had the political stability and geographical isolation. So we've been lucky for those reasons. Look, at the moment, I'm sure the other doctors will mention this as well. We've got 290 people in hospitals. Just New South Wales, for an example, 51 of those people are seriously unwell in ICU. And about half of those are on ventilators. ICU beds are limited. They're reserved for people who are seriously ill, and they require at least, 2 nursing staff constantly monitoring, specialised doctors, specialised equipment like ventilators. So in Australia, currently we have 2,300 ICU beds. Can you imagine if our numbers of serious COVID infections keep increasing? As you would expect, if we weren't in lockdown, we would quickly fill those ICU beds. This would impose an enormous strain on the healthcare system, and one of our family members who need an ICU bed, say after having a stroke or a serious heart attack, they might not be able to be given the care that they require because the ICU beds are otherwise occupied with COVID patients. COVID is real. I think we can see now as health professionals that more people are being directly affected, either within their homes or someone that they know. Over the last 2 weeks, personally myself, I've seen a significant rise in the number of people getting vaccinated. And certainly there's an increase in the number of people starting a conversation with their doctor about the concerns regarding the vaccine. Thank you, Brother Faraz.
Thank you so much, Dr. Fariha. Dr. Faisal, what are your thoughts on this particular question? Can I just bring you in for your thoughts, inshallah? And you're on.
Yes, thanks, Brother Faraj. Assalamu alaikum. Thanks, LMA, for organizing this session and inviting me as a panelist member. I'd like to just first disclose that, yes, I have been vaccinated and I have no relationship or link with any of the vaccine manufacturing industry, and I'm not involved in the government vaccination committee as such. My role primarily is deployed as a clinician and involving acute COVID management, as Brother Faraj mentioned at the very start. So, well, I got different perspectives. So I work as a clinician. So I'm, involved in the acute management. I can see how serious this disorder could be. All right. I mean, we have been seeing people coming in a flock, all right, with the white lungs, and they don't give us much time to crash in the emergency or in the medical wards. We did not see any such disease that does not have any good predictive marker. The thing is that there are a lot of unknown stuff in the COVID-19. Yes, overall mortality, if you say the global mortality, yes, is not that high, but definitely it is much higher than any other contagious disease at this point in time on Earth. And also, it is all about not just personal protection. There are high-risk groups. If we are not taking it seriously and not taking the precaution in terms of the social distancing, vaccination, we would be continue to spread the infection to the higher risk group, and where the mortality will be completely different. Now, let me tell you something about the mortality rate in hospital. All right, as I say, yes, the overall mortality, 80% people would be managed at home and they don't need hospitalization, and they would be, they have no issue whatsoever as post-COVID complication. But the number of people that ending up in hospital, 1 or in 4 of them ending up in the critical care management, requiring ventilatory support, mechanical or any sort of non-invasive ventilation, some sort of medication to keep up the blood pressure, etc. And those who ending up in ICU, 60% at this point in time, after going through a lot of research up and back and forth about the management, and we probably have got some strong evidence-based guideline, still the mortality is as high as 60%. But I can tell you one thing, at the very start, when COVID knocked down in US, there was a data of the tertiary center, the 80% people who have been intubated were dying. So there's no way we can't underestimate the intensity of it as an individual level, as a global burden as well. Thank you, brother.
Thank you, brother. Dr. Faisal, thank you so much. Dr. Abdul Latif, you are quite close in some ways to what's happening on the ground. What is your perspective on this particular question?
My impulse is to, just regurgitate some of the stats that we all know. But I think if you move away from the medicine and you realize that this pandemic has united all the governments of the world, and that's a metric that you don't often get throughout world history. Be it corporations around the world, be it governments, be it the healthcare establishments. For all of these different parties to unite and to say there's a problem, that's an indication that this is something very, very serious. If you go back to the stats, 4 million confirmed official deaths worldwide, that's serious. And you look at countries like India, you look at countries like Indonesia, and just the images that have been transmitted right into our lounge rooms, that's all the evidence you need. But even if you want to dismiss those as developing countries with poor infrastructure, look at Italy, look at the United States, look at France, look at the UK. All of these countries with world-class healthcare systems have been tested and stretched to the limit. Okay, if the numbers don't convince you, the images should. If you don't trust the medics, if you don't trust the doctors, if you don't trust the governments, look at the way businesses are reacting. For all of these indicators to happen at the same time, that should convince anyone who's fair-minded, anyone who's being serious, is actually having a serious conversation, that this is something very serious. And you go up to people who've had coronavirus, you go up to people who've been in intensive care, you go up to people who have what we call long COVID, and all of them will tell you this is serious. There is a consensus across all sectors of society, across all doctors, across all governments worldwide, that this is serious. I believe any fair-minded person should be persuaded.
Thank you so much. Just a follow-on question from that. Dr. Fariha, I'll start with you again. What are the long-term implications and complications that can arise from COVID? Going to something Dr. Abdul Latif has just mentioned, long COVID. What is it, some of what you're seeing and what the medical profession is dealing with in terms of people who are left with the lingering side effects after the acute phase of the illness is over?
Sure, Brother Faraz. There are certainly long-term complications for some people who suffer from COVID-19. Even people with mild illness can continue to experience symptoms after the initial acute illness. Most people with mild illness do recover within 2 weeks. However, some people with COVID are referred to as long haulers, meaning that they continue to experience symptoms like fatigue, shortness of breath, joint pain, chest pain, even impaired memory and concentration, muscle aches that can continue, for as long as 6 to 8 weeks after even a mild COVID illness. Then you have those who suffer from more moderate and severe COVID-19 illness. They may suffer more serious long-term complications like organ damage. As most of you are aware, COVID-19 primarily affects the lungs, where scar tissue can cause long-term breathing problems. It can also damage the heart muscle, causing an increased risk of heart failure and other heart problems in the future. It can cause things like strokes, seizures, nerve damage, and it may even increase the risk of illnesses such as Parkinson's and Alzheimer's. So the other concern was, clots. COVID-19 actually increases your risk of forming blood clots. The other thing is I want to mention, apart from these physical long-term complications, is that we cannot underestimate the severity of the psychological impact that may occur following COVID-19 infections. People surviving the infection, particularly those experiencing more severe symptoms, are more likely to develop things like post-traumatic stress disorder, depression, and anxiety. Thanks, Brother Faraz.
Thank you, Dr. Fariha. And might bring in Dr. Faisal again. what clinically do you see, Dr. Pessel, in terms of people and the long-term complications that are left after COVID-19?
So first of all, that we have been lucky on the, we just like living in a different part of the globe, that COVID was not an issue whatsoever until this second wave hit us hard. And hence, we don't have any local data in terms of the post-COVID complication. So predominantly, we are relying on the data that are available from, the US, UK, where that pandemic hit it very hard. So primarily, as we all know, that COVID is an infection that involves the lungs, and hence there is the primary, predominant sequelae that patient would have been suffering after the COVID infection. So the complication would depend on the disease burden. So yes, there could be some mild symptoms, people who have been, who suffer from mild COVID, in terms of some kind of fatigability, etc. But those who ended up in hospital and have got multiple organ involvement, and that can have long-term sequelae. And we have so far have found data that COVID can cause primarily the lung scarring, especially the those who are ended up in ICU or requiring oxygen. And there is no strong evidence that how far that can continue or whether it would reverse at some point. But so far, we have, that there have been studies that showing that it can go beyond 6 months, requiring long-term treatment, and they are quite, symptomatic in terms of shortness of breath, fatigability, and some of them would have go for long-term rehab and requiring supplemental oxygen as a home therapy. Secondly, it also can involve cardiac muscles, the heart muscle especially, and can cause inflammation of the heart, enlargement of the heart, and some sort of heart failure. And there is a 5 to 10% global data that have been implicated that long-term implication that COVID can have on the heart as well. But those who have already been hospitalized, one of the major concerns that that Sister Faria has touched base that COVID is one of the disease that can cause clot formation. We're talking about blood clot a lot these days, but COVID itself is a disease that can clot in the multiple organs, in the lungs, in the kidneys, in the brain. And on those clots, you need a long-term blood thinning medication, and a permanent organ damage can happen as well.
Thank you, Dr. Pessel. Dr. Ashraf, if I can bring you in. Assalamu alaikum, Doctor. Tell us about the long-term implications from what you've seen and seen out there in the field.
Yeah, thank you. Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. I just thought it might be worthwhile just putting everything into context. When people are talking about COVID and COVID-19, and it becomes very philosophical and very theoretical, no one's ever seen the virus. One of the simple ideas of just drilling this down is when you get COVID, you become short of breath. That's the main problem. Your breathing becomes a problem. Now, if you've ever run a long way, 5-10 kilometers, if you're not a runner, you're breathless. The only reason why this virus becomes a problem is because just like asthma, and asthma can kill you, is because you get exhausted and you cannot keep on breathing for yourself. When you get so exhausted, it's so exhausting to keep on breathing. So when you actually get tired, you end up, where can you go? You can't go anywhere else except to the hospital. The thing is, when you get to the hospital, it's almost too late. That's the idea of the vaccines. We want to get to you before you have to end up in the hospital, because if you get to the hospital and you're too exhausted, that's when you have to go to the ICU, where you have to go onto a breathing machine. Something has to breathe for you because you're too tired. It's too exhausting. That's the main issue, that this COVID virus, and we have to get that into people to understand. It's very simple. It's really difficult to, when you're short of breath, there's nowhere to go. That's the idea of this vaccine. The vaccine is the thing to prevent you from getting to that point. So I thought it's a really simple idea, but we don't want to get to those problems and long-term complications. We want to stop it. We want to stop you from going to the hospital, going to ICU, and all of a sudden having these complications from being on the intensive care machine. You can get pressure sores, clots, all sorts of things, let alone the medications that we have to give to people to keep them alive. I mean, we haven't even spoken about those things, so I think it's a very simple message to get out. We want to treat people before they get to hospital.
Dr. Ashraf, I'm going to ask a question from the audience, sort of, to some of the, I guess, the physiological parts of what you're mentioning. What is the difference between this virus and pneumonia? How do you respond to that?
Yeah, I mean, I don't think, I as an orthopedic surgeon, I don't see much of a difference. I think the problem and the main difference is with a pneumonia, especially if it's bacterial, we can treat it. People can get a mild pneumonia or, sort of a severe pneumonia, and we just fill you with antibiotics. We literally chuck the drug cupboard at you, and you should be okay. But with this COVID, because it's a virus, none of the actual medications work. That's the whole concept. And if you've ever had really bad pneumonia, and more importantly, if you've ever had a child that has had a severe asthma attack, and to me, if you're a parent and you've ever seen your children have a severe asthma attack, they're exhausted. You turn up to the emergency room and literally the doctor gives you this little drink, prednisolone, the syrup. Wallahi, it's like a miracle. A miracle. Within like half an hour, 20 minutes, my kid was like literally blue. The rib cages are going up from asthma. He's a little, I think it was 7 or 8 year old. He took the little prednisolone syrup within like 30 minutes, 40 minutes. He was pumped. He was like, "Hey, Dad, let's go. Let's go out for a run." I'm like, whoa, just relax. That's the crazy prednisolone high that you got. But so the idea is that there is no fundamental treatment. The only treatment there's all these other drugs that we can continue to talk about, and there's a debate and there's studies once you get COVID. But the only thing we have right now before you get to the hospital is a vaccination. And by the way, vaccinations, it's not that big a deal. Just quietly, it's this big, it's this much bit of water. There's not much of an even active ingredient. So I think, the idea, we just have to really push this idea.
Thank you, Dr. Ashraf. And look, in the interest of keeping the conversation really real, we're going to do just that, and we are going to ask questions that the audience is sending to us. I'm going to pluck one, and just to show people that we're really engaging with what you're saying. There's a question been asked: was anyone on today's panel given a financial incentive to appear? Let me assure you, no one has received any financial incentive whatsoever. This panel has been put together in the space of a couple of days. Everyone is giving up their time out of the goodness of their hearts and for the desire of their community and to improve the lot of our community. So no, that is absolutely not the case from myself and all the doctors. And actually,
can I just say, I make money. I'd make more money as more people get sick. And then if they get so sick and they get pressure sores, that's when I get asked to do amputations of digits, especially in little kids. So can I just say, sometimes we actually, what we're trying to do is give truthful and real information, and it's from experts. You can see all of the experts here. This is not a panel where you're just getting money and just getting paid by the pharmaceutical companies. I think that's just, you just have to make that clear.
Yeah. Someone is asking, are doctors given financial incentives per vaccine that they issue? Dr. Fariha, maybe I'll go to you on this one. Sorry, you're on mute, Doctor.
Apologies, Brother Faraz.
No, all good.
Sorry. Is that better?
Yes, we can hear you.
So, look, we've got Dr. Faisal Chowdhury, who's working on the COVID wards, probably 12, 14-hour shifts, if not double shifts, nursing staff, hospital staff. They're at the forefront of this pandemic. I feel like I'm battling a war at my surgery, but they are the real heroes, the champions of this pandemic. Like I said, they're working tirelessly treating the more severe COVID-19 infections. GPs from our end, we're more on the phone with the milder COVID patients at home, giving them support, counselling, and letting them know if they need to go to the hospitals. These professionals, they risk themselves and their loved ones every single day because they're intrinsically driven to serve and help the community. As I said, I'm a GP, and vaccinations are provided to us for free by the Australian government. we are then able to deliver the vaccines to the general community. There is a Medicare fee for a GP providing the service of assessing a person's suitability and then delivering the vaccine. However, it's no more than what a GP would receive for a normal consultation. Actually, the amount of paperwork, the extra staff, the safety checks required to deliver the vaccine safely means that GPs are often financially at a disadvantage by opting to participate in the vaccine rollout. Again, GPs would be driven by the purpose of having as many people vaccinated as possible to minimise harm caused by COVID-19, reduce hospitalisations and ultimately deaths, obviously, and have us return to some form of normality. We know there was a question about the testing and the money involved with, testing the swabs. Testing saves lives. That's why they're done. It's one of the main ways we can prevent the spread of the virus, along with the other protective measures, like the masks and the social distancing that everyone's been practicing. So no, there's no extra incentive more than what we would normally be involved with, the other childhood vaccines, for example.
Jazakallah khair, Dr. Fariha. Dr. Abdul Latif, just want to come to you with a question. And this is a question that's been asked, on the internet during the pandemic quite a lot. Are there patient deaths that are being incorrectly reported as COVID-19 because, hospitals are incentivized to show that more people are dying so they can receive more funding, for example, for their particular hospital?
So any doctor who's worked in hospital knows that when someone passes away, you need to put together a certificate, essentially outlining the cause of death. Now, for most people who die in hospital, there are several causes that contribute to the death, but ultimately a clinical judgment is made whereby the doctor assigns one principal cause of death that then goes into the system. So with coronavirus deaths, as with heart attacks, as with any other cause of death, ultimately comes down to clinical judgment. There isn't some sort of secret chamber in the basement of a hospital where doctors get together to conspire and say, let's push forward the number of coronavirus deaths. That's not the way it works. Ultimately, it's clinical judgment, right? And doctors aren't incentivized in any way whatsoever to put down coronavirus as a cause of death. It's just clinical judgment. And that clinical judgment is based on a whole range of things. So you'll have investigations, you'll have a positive coronavirus test, you'll have extensive treatment of the treating team, and that's when the judgment is formulated and typically confirmed by the most senior doctor on the team.
Thank you, Doctor. Next question is one we're being asked quite a lot online, and so I want to, out of respect for our audience, really deal with this one, inshallah. I might start with you, Dr. Ashraf, on this one. What are the ingredients in the COVID-19 vaccines, and how do we know that they are safe?
Yeah, thanks. I mean, I've got pictures from the TGA. We know exactly what's there. But I mean, if I want to sort of make it into a sort of a very simple idea, if you've got a certain proportion of the fluid, most of it is actually salt water, sugar, and things, and there's a small little bit of the active ingredient. And in fact, most of the actual vaccine is trying to actually keep the active ingredient stable enough so when it gets injected, it actually goes into the body. So there's sugars and salts, and then depending on which type of vaccine will determine what they've got. All of them nowadays have one of them, obviously the Pfizer and the AstraZeneca. The Pfizer obviously has the mRNA, which is a code of the spike protein that's purely synthetic, and it's basically popped into a bit of fat just to make it simple with fluid, and it's injected in. And then you've got the AstraZeneca, where they've actually got the code for the actual spike protein for the coronavirus, and they've put it in a viral vector. It's actually a chimpanzee adenovirus. It's a cold, and you stick that code into the actual virus of the chimpanzee or the monkey. I can give you and I can pass you on from the TGA, from the Australian manufacturers of Pfizer, AstraZeneca. We've got the boxes, we've got the ingredients, we've got the pictures of the ingredients. We've actually got them from the Australian government, got from TGA. We've bothered to get them from Pfizer themselves and from AstraZeneca. The ingredients are the ingredients. It is what it is. There is no somehow them putting in other ingredients. We've organised for that to be assessed, and the over 4,000 doctors from the British Islamic Medical Association, BIMA, have looked at it and have okayed it from a halal perspective, you know, in terms of is there any halal or haram. The one thing is that the AstraZeneca does have 0.002 micrograms of ethanol, so a type of alcohol, 0.002. That's the same amount of alcohol that's found in bread or milk. That's how small it is. But apart from that, there's no fetal cells, for example. There's no human, or there's no animal or porcine or pig gelatin or anything like that in these vaccines. If anyone does want them, they can be found on the TGA. I can add them to this site, can send it to you, can send you pictures of the actual boxes, pictures of the actual ingredients. But essentially, it's an active ingredient. And the irony and the funny thing is, the vaccine is so unstable. It's so difficult to deal with. That's why the Pfizer is -70. So half of the actual problem is to try and keep the active ingredient so it actually works. All the vaccine is a tiny amount of a challenge to your immune system, and your immune system, this should be a reminder for anyone that has any Islam in them to understand that, and to have the beauty, and the beauty of your immune system is that it's rapid. Once they have this tiny little challenge, the immune system suddenly picks it up and suddenly wants to actually acknowledge it and try to protect the body from it. So it's an amazing system.
Thank you, Dr. Ashraf. I want to go to a question that we've had coming up, and I am just want to tell our audience very openly, because a few people are asking, are these questions going to get asked? The truth is that yes, they're going to get asked. Yes, we came in with pre-prepared questions only because we went out to the community and we asked people, what would you like to see answered? And so we had a list, but we're sort of not throwing that out the window. We are going to your questions. So please rest assured, this is not scripted, and we are very much taking these questions live. In fact, I've just said that to a couple of brothers and sisters. So one that we've just received, Dr. Fariha, I want to come to you because we were chatting about this just earlier. So we've had the 7th death attributed in some way, shape or form to the AstraZeneca vaccine, and some side effects that people may say have resulted from that. What are your thoughts on this? How do we interpret this? What would you say to people who are asking the question, doesn't this mean that 7 people have died as a result of the AstraZeneca vaccine? And doesn't that show that the vaccine is dangerous and risky? What would be your response to that?
Thanks, Brother Faraz. Firstly, I'd just like to say that we are fortunate in Australia. We've got 2 very effective vaccines, being the Pfizer and the AstraZeneca vaccines, and possibly in the near future, we're probably going to be offering another 2 vaccines. So just to put things into perspective, because it is all about how you deliver the information with regards to how you're then able to interpret it in an accurate manner. So with 2 doses of either the Pfizer or the AstraZeneca vaccine, we are seeing 90% protection against severe disease, hospitalisation and death. It's also very encouraging to see that the vaccines also significantly reduce the risk of transmission from one person to another. So this problem with the AstraZeneca vaccine is real. There is a risk there. The aim of any vaccination program would be to reduce, the illness-related harm. So in our situation, it's COVID. The risk of this condition called TTS, so thrombosis and thrombocytopenia syndrome, it is very low. However, it's not 0. So if you just want to kind of compare some numbers in a simple way, if we compare different age groups, so we don't say we're just taking kind of a skewed approach. If we just look at 25-year-olds first, the risk of dying in a car accident is 38 in 1 million. The risk of having a serious side effect from the vaccine, like TTS, is 11 in 1 million. And the risk of dying from COVID infection for a 25-year-old is 23 in 1 million. So you can see the risk of this serious adverse reaction from the AstraZeneca vaccine is still the lowest. Now, when we go to 55-year-olds, the risk of a serious side effect from the AstraZeneca vaccine, being death, is 1 in 1 million. So the risk does reduce with increased age. So that's why the current recommendation Well, the preferred vaccine, if it's available for the under 60-year-olds, is currently the Pfizer vaccine. And the recommendation for the over 60-year-olds, the preferred vaccine is the AstraZeneca. So just going back to that statistic, which I'll give you, for the 55-year-olds, the risk of death from an AstraZeneca vaccine is 1 in a million. However, the risk of dying from COVID goes up to 800 in a million. So you can see it's all relative. Unfortunately, the information that we've been given by the media is very distorted. It is very concerning, obviously, when you have a death related to, a vaccine. However, we are in a pandemic situation, and if there's a shortage of a preferred vaccine for an individual, it is advisable to take the vaccine that is readily available, as the risk of serious side effects from the vaccine is significantly less than the side effects of having a COVID infection. Thanks, Brother Faraz.
Thank you, Dr. Farhad. Thank you so much. Dr. Ashraf, just want to go back to you. I've received about 10 people asking the question, is there graphene oxide in the COVID-19 vaccine? And I just had a quick look at some websites, and clearly it seems to be one of those things that's floating around. So can you tell us, are the medical establishment putting graphene oxide in these vaccines without telling the public?
Let me just, Graph doesn't, let me just, I've got the ingredients here. So I can read.
And we've had requests to have those ingredients put up, so we will put that on the Facebook page. Yep.
I can just give you the I can put that up. Graphene, in which so at the moment, so if I read, I can literally, so for the is it AstraZeneca or AstraZeneca? I've got disodium etylate ethanol absolute. That's the 0.0. That's the 0.002 micrograms. You've got histidine hydrochloride, histidine, magnesium chloride, polysorbate, sodium chloride, sucrose, and water. That's the AstraZeneca, and I can give it. While I'm not speaking, I'll add them on. I'll put these both up, and then you've got for the Pfizer, you've got hydroxybutyl, polyethylene glycol, diasterol phosphatidyl choline, cholesterol, potassium chloride, potassium phosphate, sodium chloride, sucrose, water, potassium. Yeah. So that's, there's none of these graphite. I think, like I said before, one of the ironies that you've got is most of the actual parts, remember, when you act the ingredients, they only last and are broken down within a few days of the body. This is only a challenge to your immune system. You only have it for a couple of days, and then that's it. Your immune system sort of recognizes, anything that's going to come with a spike protein, I might be able to fight it. In my analysis, it's like you're in a boxing match. Every day, your immune system is being challenged. Infections, viruses from your mouth, nose, eyes, you're always being challenged. This isn't your only challenge. This just happens to be one. And hopefully, and it's not even enough, you have to challenge it a couple of times. You have to have 2 doses. So the idea, it's almost like you're giving too much merit to the vaccine. This is our best chance to make you less sick. That's the whole concept. And so I think, and when I'm not, and I can show you the ingredients, and I'll put them up into you. If I put them just into your into the chat box, I think everyone will be able to.
Yeah. No, look, we'll get the LMA to put it on the page, inshallah, afterwards. So please do send it through. Dr. Fatima, I want to bring you in here, sister. I know we haven't gone to you yet. Jazakallah khair for your patience. Getting a lot of questions about women and pregnancy. Should pregnant women avoid getting vaccinated? What is the risk associated? Can you shed a little bit of light on this as an obstetrician gynecologist? You're obviously all over this area, so please, share your thoughts with us, inshallah.
Assalamu alaikum. Assalamu alaikum, everybody. And thank you, Brother Faraz. Thank you, LMA, for such a timely discussion and a timely topic. And though it's a Zoom meeting, but I would still like to acknowledge the traditional owners of the land and pay my respects to elders past and present before I present my view on this. So pregnancy. Recently, recently, you know, our college, the RANCOG, the Royal Australian New Zealand College of Obs and Gynae, then the ATAGI, as well as the British College, which sort of coordinates the women's health activity globally, have both said that pregnant women can be vaccinated. It is as safe as it can be. And the data has been obtained from America. But before I talk about it, just a little bit about pregnancy and COVID-19. Pregnancy is a very important time in a young woman's life. People are motivated and ready for meaningful discussions, you know. And pregnancy is considered a higher state because of the physiological changes in pregnancy, and it is relatively immune deficient state. That is why a woman can carry a half foreign genetic baby till term, you know. And because of this, usually women get seriously affected with most viral infections, but luckily, it's reassuring to know that pregnant women are no more likely to get COVID than non-pregnant women. However, some women can become very sick with ICU admission, particularly in third trimester, needing ventilation, oxygen, and all sort of that thing. And what does that do? That means that the preterm labor, particularly it's the iatrogenic preterm labor, is increased because doctors have to deliver the lady to treat her very well. And if they can't go through a vaginal birth, which is usually 10 to 12 hours, usually. So preterm labor plus increased risk of cesarean section. Actually, you know, studies from, you know, luckily in Australia, we didn't have, you know, only recently we have this pandemic, which is again, you know, becoming quite vicious, but so far we've been doing very well. So most of our data has been from overseas, America, Italy, and all those, Wuhan, and it shows that the preterm birth rate is 17 to 18%. You all know that the usual preterm birth rate is 6%. And so far, there is no association between stillbirth or neonatal death. But though last week, a study has reported that there may be an increased incidence of stillbirth. So having the vaccine protects mother from getting so sick, you know, because people can still get sick after getting the vaccine, but it is milder, you know. Currently, it's an epidemic for the unvaccinated. What is happening usually. So it's very mild. So the mothers don't get so sick, and it protects baby from prematurity and stillbirth. So as I said, the British College, our college in ATAGI, have decided that it is safe to offer vaccine to pregnant women during pregnancy, after pregnancy, breastfeeding, and before pregnancy, or before when they're considering to get pregnant or getting fertility treatment. We have not much Australian data, as I said before, because we've been lucky. But this is based on robust data from United States of America, which we know have been the worst hit, where 90,000 pregnant women have been vaccinated with the Pfizer or the Moderna mRNA vaccine. No safety concerns. And data have shown evidence of antibody in cord blood and breast milk. It offers protection to infant through passive immunity. Obviously, still, pregnant women would have to pay attention to social distancing and mask if possible. They would have to have the usual antenatal checks. You might ask the question when they should take. They can take it anytime, actually. They can take it pre-pregnancy, during pregnancy, or during breastfeeding. But we know that pregnant women feel vulnerable in the first 12 weeks, you know, or the first trimester. So it is okay to take it before that or after that. Question which you may ask, or the audience may ask, is it effective? It is. It definitely prevents infection. If you do get it, it is mild. That is what we are seeing currently, you know, in our country. In all these lockdowns. Today you said Melbourne. I haven't seen my son in Sydney for 3 months now. So it is definitely an epidemic of the unvaccinated. You were asking about the side effects. Side effects usually, like every medicine has side effects, you know. And in pregnancy, we have got experience with vaccine, not the COVID, but other vaccines, which we routinely use, the flu vaccine and the whooping cough vaccine. So similar side effects, pain and tenderness in the arm, mild fever and chills, feeling tired, self-limiting, but in balance, the benefit is much more than the risk. So I will ask the patient, the pregnant ladies and women who want to conceive, is that please discuss with your doctor or midwife and look at, you know, there is a lot of things floating on the social media and different newspapers and media, which confuses you, but it would confuse anybody. Plus it's also new, but look at responsible resources, you know, like from your doctor or from your general practitioner or midwife, or from resources put out by our college, the Royal Australia and New Zealand College of Obs and Gynae. We are covering 2 countries, and the Royal College of Obs and Gynae, which is covering the entire women population of the world, or the public health associations. So follow those, read up those. And obviously, when you are pregnant woman, previously, as I said, not long ago, we had this eligibility criteria in Australia, like, people who are older or people who are really, sick or frontline workers or were at higher risk because of pre-existing health conditions. So pregnant women, they mostly didn't fit in that eligibility criteria unless they were frontline workers. But because of this current pandemic, everyone is eligible. Pfizer vaccine over the age of 16, I think. Yeah, correct me if I'm wrong. And AstraZeneca over the age of 18. So if a pregnant woman comes to a doctor or a midwife, the first thing is counseling so that you can have a shared decision making, give them everything so that they make a informed decision, And then when you give them the vaccine, of course, it is very important for us to data collection. Otherwise, where will we get the data? Where will we get the statistics from? I'm sure different states, this only now becoming universal for all pregnant women. I'm sure the different states and territories in Australia will ensure that happens. But what I'm thinking is, these days of electronic medical records, and though I don't like the electronic medical records very much, but still is very good. So when a pregnant woman gets vaccinated, if we can connect to maternity outcomes, then, we can we can get longitudinal data on how pregnant women are doing in Australia.
Jazakallah khair, Dr. Fatima. Just one follow-up question for you. Does taking there's been asked by the audience, does taking the vaccine increase a pregnant woman's chance of miscarriage?
No, that was the thing I was going to say, that, the previous COVID epidemics we had, SARS-CoV-1 and MERS, they did for some reason, I know the reason, causing profound hypoxia, but COVID-19, first trimester, it does not increase the risk of miscarriage. In fact, it does not even increase the risk of teratogenicity. Because if you go back to the basics of COVID, the COVID virus to infect a cell needs the ACE receptors and the TMSRP, something a facilitator, which is not present in the placenta. So COVID or the infection itself or the vaccine does not increase the risk of miscarriage. However, in first trimester, fever or temperature, high temperature for any reason can cause neural tube defects, even if you are taking folate. So high fever from any reason, even from COVID-19, can cause that problem.
Jazakallah khair, thank you. Want to just change tone a little bit. Might go to Dr. Abdul Latif here. Brother, tell us in as succinct a way as possible what the idea behind the concept of herd immunity from vaccines is. What exactly is this? Because it gets thrown around a lot, and that the vaccine doesn't provide it, and so forth. What would you say in the most succinct way possible, defining herd immunity and what the entire idea behind vaccination is?
I'll answer that, but can I just go back quickly to the graphene oxide?
Absolutely.
I find this selective scientific reading that some people have actually pretty funny, where they'll be able to access some obscure conspiracy theory written by a non-mainstream scientist or doctor, but for some reason they can't find the millions of pages and thousands of journals outlining the case for vaccination, be it coronavirus or otherwise. I think we need to sort of not engage with these sort of arguments and give them credibility, because they are not credible arguments. They are made by people who don't know what they are talking about, people who are not seeking the truth and thereby concluding that they don't want the vaccine. It's people who don't want the vaccine going out there searching for anything that they can get their hands on to justify a very flimsy case. It's as simple as that. I had a guy at the vaccination hub. He came in with his wife. He had papers upon papers about the risks of the vaccine. He didn't even know how to pronounce the ingredients he was talking about. And in the end, we realized he's actually got a phobia of needles, right? That was the problem. Going back to herd immunity, in as simple a way as possible, when enough people in the community have antibodies to the virus can't really spread amongst that population, because there aren't enough hosts for the virus to spread around, because the immune reactions are so powerful that people won't be infective enough to spread it to others. You can get to that in two ways. You can get to it through vaccines, or you can get to that by letting it rip in the community. With vaccines, you're unlikely to have any harm of that vaccine. Whereas if you let it rip and await natural immunity, a lot of people will die in the process.
And so on that then, the idea behind a vaccine, and some people are asking this question as well, is it that you can still get COVID-19 and it's unlikely to be as severe? Is it that you are less likely to be infectious? What exactly is the mechanism of, I guess, the operation of the vaccine to produce that, I guess, individual immunity or herd immunity, or you know, making individual people sort of resistant to the, or resistant enough that they don't then spread it to others? Can you just clarify this point, because it's being asked by a lot of people, is that what's the idea behind what the vaccine is meant to do to you?
Sure. So in terms of reducing transmission between people, last I heard, the vaccine reduces transmission by about 30 to 40%, right? But what makes this vaccine so essential and a scientific miracle on a public health level is that it will reduce severe illness and death by at least 90%. And this isn't just a theoretical statement. We've seen this in all nations across the world with high vaccination rates. They're still getting significant case numbers, but severe deaths have plunged. So, quick example. In Sydney today, a city with very low vaccination rates, we had about 260 cases, about 4 deaths or 5 deaths. In Washington, D.C., also today, we had about 5,500 cases with much higher vaccination rates with 4 deaths. That is the key function of this vaccine. Less people will die, less people will end up in the ICU, less people will be on ventilators. That is what the vaccine has set out to do, and it's done it with flying colours.
Jazakallah khair. Thank you, Dr. Latif. Dr. Fariha, if I can just go back to you, can you just explain the different types of vaccines, right? So a lot of people throwing out jargon, which they may or may not understand in the community generally, not necessarily anyone watching today, but mRNA, right? Adenovirus, right? There are different ways that vaccines work. And a lot's been said about the mRNA mechanism of, for instance, the Pfizer vaccine. Can you just tell us broadly, what are the different buckets? How do they operate differently? Just so we can have some common terminology for this conversation.
Brother Faraz, I might pass this one to Dr. Ashraf Chahat. I think he'd be better equipped to answer this one.
Yeah.
Sure. So I think so. The idea is that there's two types. Obviously, they're both mRNA. They're just the codes. So So what was the quick? So you wanted the types? Is that where you?
Yeah. How do they function? How do the different vaccine types sort of function?
Oh, okay. So basically, the idea is, if you think of coronavirus, I think of it just like a soccer ball, and it's got spikes. And basically, what we have is a code now where it's a miracle that they now know, just instead of giving you the whole coronavirus and we give you a very weakened strain, they know now how to the code of the actual coronavirus, the actual spike only. So we only take the code that makes the spike, and that can be either made completely synthetic. So the Pfizer is completely synthetic. So all it is just that code, this nano tiny little bit of code, they stick it in a bit of fat and they send it off. Now, some people say, oh my God, it's mRNA, it's a code, it makes a protein. Oh my God, mRNA, it sounds like DNA, or the RNA is going to make DNA and it's going to affect me. I'm going to turn out like a chicken because it's from an mRNA, or I'm going to turn out into a gorilla. That's not the case. Why? 2 reasons. The mRNA, in order to get the mRNA does not go into your nucleus. If it went into your nucleus, that's where the genome is, that's where our DNA is. The mRNA does not go there. It goes into an area that creates the protein. That's the first thing. So it's in a different area of the cell. Second, you need reverse transcriptase. You need an enzyme to convert the RNA into DNA. So these two reasons are the factual reasons why it will not affect your DNA. The other part, obviously, is where they've got the same code, the mRNA, in order to make the spike protein of the virus, and they've stuck it in a cold. That's called, we call them adenoviruses. You know, there are heaps of colds. There are heaps of adenoviruses. That equals an adenovirus equals a cold. It just happens. What you don't want is to give someone a cold that they've seen before, because otherwise your immune system will attack it and it'll stop the vaccine from working. So they've chosen a cold that hopefully none of us have ever seen before. How do they do that? They've chosen it from an actual chimpanzee or a monkey, because none of us, assumingly, have ever encountered one of those creatures and caught a cold from them. And that's the actual AstraZeneca, where they've stuck it in that virus.
Dr. Ashraf, can I just clarify a point with you? It is of my understanding that the mRNA and the DNA that's used in these vaccines, it's broken down by the cell once the spike protein has been formed on the cell. And then from that point, the body will then make antibodies against the spike protein. So the mRNA is actually disintegrated, right? So once it gets into the cell, it doesn't go into the nucleus, so it doesn't modify your DNA.
It doesn't go into the nucleus, it goes into the endoplasmic reticulum. So the mRNA, that's the code, it's an RNA, goes into the endoplasmic reticulum. So the cell's really big, there are all these different compartments, goes into the endoplasmic reticulum, starts making the protein, and then once it makes the protein, which is the spike protein, then the problem is, that's the irony, that's the beauty of how we're made, that once it's made that protein, it only lasts a bit of time before the body actually obliterates everything. Yeah. But in that really short space of time, your immune system goes, whoa, spike protein, oh my goodness, we don't like these guys that have got spike proteins, I'll remember you next time. Yeah. And so that's that whole concept. And what's really interesting is, unfortunately, even in that few days, sometimes everything gets broken down. Like even then, that's the theory. Actually, our immune system can break it down so quickly that you don't get a response. That's what and even more important is, some people are like, oh, I just want to be natural. In fact, a vaccination is as natural as they come, because you're reliant on your own immune system. That's why if you're really elderly and your immune system is so poor, it doesn't matter how much vaccination you get, you don't seroconvert. Your immune system isn't strong enough. Hope that helps.
Jazakallah khair. Thank you, Dr. Ashraf and Dr. Fariha for that. Want to sort of there's so much coming in, it's hard to keep up, but let's go with this one. So someone has said, look, I'm convinced that COVID is bad. I'm not questioning the virus exists, right? And that the vaccine is the only way out of this. But personally, I would rather wait as long as possible before taking the vaccine, just to take away the risk that it might affect me. I might be one of the very, very few, right? How would we respond to this from a public health perspective? Dr. Faisal, let me start with you. It's been a while since we heard from you. How would you respond to a question like this?
Do you mind to repeat the question, brother? I a little missed out.
No problem. I was saying, so the person is asking, I'm convinced that COVID-19 is bad, and that the vaccine is the only way for society to get out of this. But personally, I would rather wait as long as I can before getting the vaccine, right? How would you respond to this question?
Sure. So I believe, brother, a bit of a tricky question just to answer. So, well, I think there is a communal responsibility involved in this scenario as well. I would say, well, look, I mean, we think as an individual, that's right, but also we have some responsibility to the community that we are living in. So we don't like to be the carrier of the virus itself, being unvaccinated and spreading around the infection. From the very start, I can see given one example, and this was a gentleman that when I was at the first, when the COVID came in, a gentleman who flew from overseas and came to Sydney, and then he drove to a Barrel, and then at that time he found to have a COVID positive. And when I called him just to follow up his well-being over the phone, and he gave me a nice message. I told him, look, most important, I'm not a public health expert, but the most important bit is self-isolation, not to expose, etc. He told me, look, brother, I'm 30 years old, I'm healthy otherwise. I'm not worried about myself. I'm rather worried about that 8 years old lady, frail lady, who is working in the community, who got multiple medical issues. And if she get exposed, it could be a death sentence for her. So I think from that point of view, yes, I think you need to, you're just not thinking about yourself, but as a general, you have to think about if you don't have a immunity, or if you don't get the herd immunity, as Dr. Abdul Latif was pointing out, that we would not win this battle. And this is going to be a never-ending game for us. Yes, understand that personal level, it might not be the high risk. Secondly, I think, the risk itself is unpredictable. And, people have been flagging that, yes, I don't have any medical problems. I'm not counted as a high-risk patient. Why should I be bothered by the vaccine? But, there is something called genetic mapping and genetic morphism, polymorphism, that kind of thing. We're seeing people dying, being young. And as you might be aware, there are a couple, at least, as far as I know of, that died below 40 years old, okay? And they have come into media. One died at home, below 40, and one died at one of the tertiary hospital centers. So we don't know how that COVID is going to affect you at the end. And thirdly, I think, we like to go back to the norm, all right? Smallpox. Think about smallpox, think about plague, think about a lot of, historical contagious infection. The world would be different if it continued. And the world would be different if we can come to end of this pandemic.
Thank you, Dr. Faisal. I'm going to go to Dr. Ashraf and then to Dr. Abdul Latif on this particular question, because the same question that I've just had, Dr. Faisal, I just want to get some as varied perspectives as possible, because this really becomes about, how you as an individual sort of sit vis-a-vis society, right?
But I mean, can I just say one thing?
Yeah, brother.
Rasulullah sallallahu alayhi wasallam said, if you smile to someone, this is an adequate act of sadaqah. If you smile at someone, just that. Can you imagine that the idea of you believing that if you, as a self, the person themselves says, look, you know what, I'm pretty good. I'm just going to go do Fajr in the morning, and I'm going to do in the first line, and inshallah, I'm going to be next to the next 7 guys to my left and right that are 80 plus with diabetes and cardiac events. And in fact, you as a common carrier have no symptoms, and you pass it on to the people on the front row. The idea and premise that we're talking about is the same premise that pushes people for you to give sadaqah. The idea is for you to benefit society, to improve society. This is your opportunity to give sadaqah. It can be maybe sadaqah jariyah for all you know, because one of the acts, let alone smiling or saying assalamu alaikum, you are actually actively involved in protecting the community, so your decision yourself will affect the entire community. And where does that final, you close the loop in Islam? Surah Ma'idah. Everyone knows it, I'm sure. You save one life, you save the world. But what is the essence of that? The essence is trying to drive the individual on protecting everyone else. So the idea is the individual that comes to Jummah Salah has a relationship with everyone else in the masjid. And he says, oh man, what are you talking about? I know Abdullah and Mahmoud and he can hardly breathe and he's an old guy. How can I pray and be a spreader of something, let alone COVID? If you have garlic on your breath or you're smelly, don't come to Jummah. Don't come, because it will offend people. I mean, these premises we all know, and if you don't know, you should know. And this idea is so fundamental to who we are. That's what we're talking about, because Islam is not meant to be an individual Islam. It's meant to be exactly what the community is doing. The Lebanese Muslim Association is trying to reach out for no other reason to the community to say, look, let's just protect each other. Let's open the mosques again. Let's get out of lockdown. Let's go and enjoy the sun. So I think this idea is a very 2021 Facebook, Dropbox, TikTok, how's your father concept. It is just, this self-worth. I'm going to take a selfie, Belfie, Melfi, whoever you are. it's not about us. The decision to take a vaccine is not an individual decision. It is about society. And if you love your society, get vaccinated. That should be the message.
Dr. Abdul Latif, just circling to you for that, for some thoughts as well.
Yeah, so the Prophet, peace be upon him, told us that whoever dies of the plague and is patient, he gets a very significant reward on the Day of Judgment. And we have precedents in our history, such as the plague of Amwas, which was in Syria at the time of the Sahaba, where we see just how they were patient and how they isolated from each other, and how the Khalifa didn't enter Syria because he didn't want to catch the pandemic and take it back to Medina. Plenty of examples, right? And it's a bit ridiculous because we're not asking people to do anything dramatic. We're saying people, just get vaccinated. It'll take half an hour of your day. All right, you'll have a muscle ache for a couple of hours, a couple of days, and a bit of a fever. That's it. You protect yourself, you protect your family, and I think it's a bit embarrassing. Like when you see what's happening in Indonesia, when you see what's happening in India, you have people dying at the doors of hospitals, no oxygen, people being buried in mass graves. The fact that we're even having this conversation, it's
not good. In fact, I know it's not my forum to speak up, but I think I want to share some thoughts with the audience just from my perspective. I'm from India, and I counted. We have had 12 family friends, older relatives, pass away from COVID-19 in the last 3 months alone, subhanAllah. And the closest was what would be my grandmother, I suppose, in a way, like my grandmother's sister. So very, very close and like a grandmother in many ways. Multiple uncles, second cousins of parents and stuff like that. All COVID-19 diagnosed, in the sort of the burst that happened in India and in the sort of March to June sort of phase. So that's speaking to Brother Abdul Latif's point that this thing is very real, and the impact on countries where it's gotten out of control is just absolutely horrible. So Jazakallah khair if people had that immunity there, then obviously the impact would be so much more bearable. But for practical reasons, it hasn't happened in those countries. But in a country like Australia, where something can be done about it, I guess there's an imperative to do so. I just want to read out a comment from Dr. Jamil Khan on Facebook. He's tuning in. He's a Sydney-based doctor. He's telling everyone he's a very happy-go-lucky type of older brother and doctor in our community. He's saying, everyone, I had my vaccination today. I'm a practicing doctor in the community. Had a slight headache after the vaccine, but hoping it'll be fine. I've had hundreds of patients have had the vaccine. Just telling everyone that it's not the end of the world. You get slight side effects and then they go away the day after. But he just wanted to opine as a doctor that he's seen nothing at this point in any of his patients that the vaccine has been administered to. So, Jazakallah khair, Dr. Jamil, for your comments. Yes, Dr.
Can I just say something quickly? So I do shifts at some of the bigger vaccination hubs in Melbourne, and on any given day you'll get, say, 2,000, 2,500 people walking in. I've done plenty of shifts. I've only had to call an ambulance once, and that was for a woman before she actually got her vaccine. Everything else that I've come across, very, very mild, tachycardia, which is when your heart rate goes up, mainly because people are nervous and, just feeling a bit faint. We fix it with water and some jelly beans, pretty much. Thousands of people haven't had to call an ambulance once after the vaccine.
Let's go to some other questions that are coming in. Okay, so I guess this is an interesting one. So it's going to something that we were touching on before, but a lot of people are asking this question. Might start with Dr. Fariha on this one. Let's talk about the long-term side effects, right? So people are saying, okay, fine, there might be some adverse reactions here or there, but what about 10 to 15 years from now? There is absolutely no research. And I want to tie this in with one other question, right, which people are asking, which is, how can a vaccine get developed so quickly, right? They're saying half the time, doctors are sort of, or people who believe in sort of Western conventional science and so forth, they're saying, oh, medicine takes time, science takes time, 10 years to develop a vaccine, multiple trials, journal articles, double-blind placebo trials, and now in 1 to 2 years, these companies have magically, this is what we're reading, have developed this vaccine. Dr. Ashraf, let's start with you. I know
Can I just throw some fact into this ridiculous conversation because it becomes stupid? Mumps in the 1960s took 4 years. Didn't take 10 years, didn't take 15 years. Took 4 years in the 1960s. Now, there were no mobile phones around in the 1960s. There weren't even computers. And it took 4 years. I mean, it's so ridiculous. Right now, if you just traverse the history of vaccines, the whole concept of vaccines was you would take a bit of the actual virus or bacteria and give it to the patient. The actual thing, they would get a bit sick and hopefully they'd survive, and that was it. We've now come all the way where we can scientifically go into the active infection, take the code just of a portion of the actual infection and give you just the code that makes a portion of it. That's the beauty of where we are. The mRNA is not a technology that is 1 year or 2 years. They have been doing this for 13 years. That's why the mRNA is the virus or the mechanism for the Ebola virus. That's the mRNA, and potentially with the mRNA, which is one of the things that people don't understand, the COVID situation has accelerated mRNA technology, where the mRNA technology may be the cure for cancer. In other words, you get kidney cancer, and using mRNA technology of the kidney cell, we can vaccinate you against your kidney cancer. So where there is a harm, there may be a benefit. We have to look at it from that perspective. Please, just listen to the experts, because otherwise it's madness.
Dr. Abdulatif, you were going to say something as well?
Yeah, look, we really should be grateful for, above all, Allah subhanahu wa ta'ala for endowing humanity with the intelligence and the capability to come up with this technology. Like, it takes an infinite amount of arrogance to look at this stuff and, just dismiss it. Whereas anyone with a bit of humility, intellectual humility or spiritual humility, would look at what we've achieved, right, and say, subhanallah. Like, the ability of human beings and how human physiology works is just beyond explanation.
Dr. Fatima, did you want to say something at this point?
Oh, even me? That.
Brother Perez, can I just add something there?
Yeah, sure.
Dr. Abdulatif, would you say that, the groundwork, the template was there, the work, the researchers and the scientists weren't paused before COVID-19, is that right? There was already work being done, there's templates, there's many other very effective vaccines. So the 10 months that it took to develop the COVID-19 vaccines is very realistic, given that everyone's collaborated globally, given the urgency of the situation, and there's probably record amount of funds being poured into this because of the pandemic, right? So whilst you see people's concerns because they don't understand the process of vaccine development, and they are valid concerns, but we can gain quite a lot of comfort and confidence regarding long-term complications or consequences of the vaccines based on the very other good effective vaccines we have. But would you also say, Doctor, that the most serious complications, if any, were going to occur from the COVID-19 vaccine, you'd expect them to happen within the first 6 to 8 weeks post-vaccination? Is that right? You wouldn't be expecting to have, 2-3 years down the track?
Because it's broken, yeah.
Yep.
Because it's broken down anyway. The vaccine is the vaccine itself is very unstable. It's very difficult to control. Within a few days, it's broken down. And one of the ideas in the last 100 years, if you look at the history of all of the vaccines, only one vaccine has been taken away. One for the neonatal for the kids, for the rotavirus. And within a few weeks, they realized there was something going on and they pulled it. All of the rest of the vaccines that we are seeing now do not have long-term complications. They don't, because there's no capacity to. It's not there it doesn't hang around the system long enough to cause long-term complications.
Can I add on something, Brother Faraz?
Yes, Dr. Faisal, please.
Yeah. So I think in regard to the experiment that people have been talking about online and in different platforms, so I'd like to just draw some actual data. So these vaccines have been experimented through the proper channel, and they went through, the multi-stage trial that you normally do any other vaccines historically. So these vaccines have gone to the preclinical trial. Then they went to phase 1, where there's a limited number of human beings have been exposed to the vaccines to look for any sort of safety issue. Then the phase 2, where there is hundreds of people, the larger population have been exposed to find out not only the safety issue, but also the actual dosing and the immune reaction, and also the efficacy of the vaccine. And then finally it went to the phase 3 trial, where the larger trial, and I can quote the number that for the Moderna vaccine, the number of population that the groundbreaking study were published was 30,000. For the Pfizer, it was 48,000, and for the AstraZeneca, 24,000. This was all pre-marketing trials. But since we had this, licensing, went to FDA and TGA approval, and the whole world, if you look at how many millions of people have been vaccinated, and what is the concern of the side effect as of today. And I'd like to highlight here one more thing: the actual data. That what is the actual data of any major side effect that we have been facing in Australia. So far, there's 93 cases out of our almost 7 million of AstraZeneca vaccine as of today have been found some sort of blood clot issue. All right, and if you count that, it would be 0.0009% of blood clot formation. All right. And if we talk about Pfizer, there is around 100 cases of some sort of, what we call pericarditis or some sort of heart dysfunction. However, it doesn't have any fatality or any sequelae or major hospital complication, etc. Now, there is one data that, the published or shared, with the Hunter New England local health district. And I like to quote this one because I found it probably would be very useful even for Dr. Faria Deep to be used in your GP center. What they actually has pointed the risk of blood clots at different disorder, and also with AstraZeneca, so a vaccine. So the data that was, probably early few months back, showing that the risk of having blood clot as a general, with the AstraZeneca vaccine is 4 cases in 1 million, which had been counted 0.0004%. However, if you compare with the oral contraceptive pills that a lot of females taking as a birth prevention medication, and the risk of blood clot would be as high as 0.12%. What about the smoker? The risk of having blood clot, people who are a smoker, clot in the lungs or the legs or anywhere else, would be 0.18%. And the COVID itself, the risk of the blood clot was higher at up to 40% at the start of the pandemic. And more recently, given we know how to treat that COVID with all this new evolution and guideline, is down to 16.5%. So we're talking about 0.004%, 0.004%, as opposed to close to 20% of risk of blood clot. And our other risk factor, the smoking, oral contraceptive pill has much, much higher risk than in a single AstraZeneca vaccine.
Dr. Faisal, can I just add to that? Can you just give a bit of clarification? There are some theoretical contraindications that possibly increase your risk of developing this fatal condition related to the AstraZeneca vaccine, being the TTS So those conditions are quite rare. Is that correct? We're talking about, you know, things like...
Yeah, that's right. Yeah, that's right.
Yeah.
Yes. Again, I can clarify that. So look, there is a screening tool for the as have been devised by the NSW Health and have been delivered in a different vaccine center. Those which is called rare, but those who have a rare blood clotting disorder would be discounted or would be precluded from having the AstraZeneca vaccine. For example, those who have got anti-phospholipid antibody syndrome, those who have any kind of blood clot in the brain, not the stroke, but it's some different kind of blood clot in the brain in the past, all right, or any major unusual blood clot, okay, and they would be, regardless their age cutoff, they would be precluded from the AstraZeneca vaccine. And once again, you know, the age cutoff 60, you know, the risk that I'm talking about 0.004, you know, as a general, but if you count it, you know, the risk above the 60, it will be much lower, it will be lower.
Jazakumullah khairan, thank you. So look, I'm going to run through some questions very rapidly now, just because I want to do justice to many of the questions that are coming. So we're going to do like quick fire, rapid fire questions, inshallah.
Can I add on one more thing, brother? Sorry to interrupt. Just I might forget one more thing, sister. Just like Dr. Faria, I like to mention that those who have received AstraZeneca vaccine and has a blood clot, all right, and you worried about not to go for the second AstraZeneca. It is also, people who are concerned that, okay, I got a blood clot. We see people coming with a blood clot, which they do have other risk factor, and we're not counting that it is a blood clot from AstraZeneca. However, this is a concern for the people who already been primed and concerned, but from different virtual platform. For them, if they got a blood clot from seeing a first dose of AstraZeneca and they're reluctant for second dose, you can move them to Pfizer. All right, and they're having studies, which is a mismatch studies that they receive two different vaccines, two different kind of modality of vaccine, and the potent efficacy or effectiveness is quite similar as opposed to having the same vaccine. And as you might know, the German, the chancellor, she had the kind of mixed vaccine as well.
Thank you, Dr. Faisal. And just to clarify, the TTS rare clotting condition is different to what the community would know with regards to clots in the legs, common name DVT, or a PE, a clot in the lung. This is different. Is that correct?
Yeah, that's right. Yes. TTS is the blood clot that can stem from the AstraZeneca with the unusual blood clot, not the common one that you can have the deep vein thrombosis or blood clot in the lungs. Okay.
Thank you.
Thank you, Doctor. So look, I'm going to run through a few rapid questions now within the next 5 to 10 minutes, and I just want I'll just throw it to someone. If you don't feel you're the right doctor, then, throw it to someone else. But let's get really punchy answers here, inshallah. So one question from a brother is, only thing I'm confused on is why AstraZeneca was only recommended for a certain age bracket and then why that was changed. Can the doctors shed some light on that? Dr. Farihan.
Thanks. That's a really important question. And I agree with the person who's asked the question. It can be confusing for the community, particularly when ATAGI and the health professionals are changing the recommendations. But the situation is fluid, and like anything, it develops. And we are trying to protect the community and really reduce the harm of COVID-19 complications. So if there is something that is putting the community at risk of complications from the vaccines, then absolutely they will slightly modify the advice. So the main issue has been with the AstraZeneca vaccine, and it's just been a slight modification to the preferred vaccine. Not that the AstraZeneca cannot be given under the age of 60, but that the Pfizer had become the preferred vaccine if the supply was available. So that is to protect the general community. And I think what it comes down to is people seeking out, accurate and reputable sources of information rather than trying to interpret a headline that says in bold, Tasmanian man dies of AstraZeneca vaccine, because that kind of information can be really detrimental and it can keep us in lockdown for longer periods of time. So the best people to speak to are your health professionals, whether it's your specialist or your GP or your nurse. They can give you that information and they can make that assessment, with regards to your medical history and your concerns, and then a decision can be made as to what is preferred.
Jazakallah khair. Thank you. We've had a brother Daniel Afi comment. I'm a doctor. I'm in my early 30s. I took AstraZeneca. We are fellow Muslims here. There's no big pharma paying anyone to issue this health advice and information. Thank you, Dr. Daniel. Appreciate it. We've got another comment from a brother, Abu Jibril, who's been very engaged on the whole episode. He's saying Jazakumullah khairan to all the doctors for their time. He says, I don't necessarily agree with everything that was said, but I really appreciate the work that you're doing to try and engage in this conversation. So thank you so much for that. And we've got a lot of those sorts of comments where people feel like there was amazing information tonight. I want to ask one important question that's recurring. Year 11 and 12 students and their return to school and vaccinations and such. I might go to Dr. Fariha because I think you might have the most up-to-date information about this as a GP in the New South Wales and Sydney community. What would you advise in this regard? People are just asking what should we do? We've got a child in year 11 or 12. Should they get vaccinated? Should we keep them at home? What's your overall advice?
So firstly, I want to give a big shout out tonight to number one, the parents, particularly of Year 12 students, to the Year 12 students themselves. And mostly I do want to give a big shout out to the teachers that are now preparing to go back to, face-to-face lessons, I think on the 16th, so in less than 2 weeks' time. So basically what the government has provided, which I think is a good plan, in the 8 LGAs, the hotspot LGAs, they are preparing to get them vaccinated next week. So they're making arrangements through schools to have students transported from the school. One of the main vaccination centres that will deliver the vaccines is in Homebush at the arena. So I think most students and parents would be in the process of registering their interest. It is not mandatory. So if people don't feel comfortable, students or parents, with the process, they can opt out. Will not disadvantage them in any way. But the idea is to get as many of them vaccinated and safe and get them back into their studies and prepare for the HSC. Obviously, the HSC this year is going to be different. It's going to look different. But the students are not alone. We're all here to support you, and hats off to you. The teachers that have got to go back to the face-to-face and have their own, couple of kids that they have to homeschool. Certainly it is challenging, and I'm not taking away from other people in the community who've all had their different challenges, but certainly we should make mention, as you have rightly done so, to the Year 12 students that, a lot of them would be very anxious. And I'm certainly seeing a lot of them in my surgery coming in with concerns. We haven't really had a lot of directive with regards to those students who wish to be vaccinated at the GP. Certainly that would be something that we would provide if they're not able to get out to the vaccination centres. So that's all happening next week.
Great. Jazakumullah khair. That's very, very important information. Thank you so much, Doctor. Let me just go through and sweep through to see. Dr. Ashraf, this is a question for you. Is the COVID vaccine safe for people with cancer?
I think for me, the idea of if you're at risk, the idea of getting a vaccine, especially if you're in the high-risk group, and that would put you at high risk, especially with cancer or any chronic disease, is to go get vaccinated. The idea, in my mind, all of the vaccinations are the same. It's like debating whether it's an Audi, a Volkswagen, or a Mercedes. They're all the same. Go get whichever vaccine you can and get the 2 doses. That's the most important, especially if you've got some form of cancer, especially if you've got some form of lung disease. Any type of chronic disorder, I think, puts you at a higher risk. And I think that's the concept here. It's all about risk assessment. That's why we're talking to the community, because every day we manage risk. No one else does. The doctors, when we prescribe medication and we actually do surgery, for example, have to assess risk. No one else does. There are people that read stuff, but they never put it into practice. We put it into practice. When you do put it into practice, there is risk assessment, risk management. That's why we are here, because when you weigh up the risk of having COVID or the risk of not getting vaccinated with cancer, you say, hang on, clearly the better risk management would be, I've got cancer, let me get vaccinated. Just on another point, just so it's very clear, you do realize that when you get vaccinated, you want an immune response. You want to get a response. The arm is painful, a fever, something, because that means your natural immunity has been challenged and you've developed an immune response. So I thought that's sometimes there seems to be a focus on, oh my goodness, I had the immune response, I had the vaccine and I felt so sick the next day. That's good, because overseas, one of the red flags of getting a vaccine with nothing in it but water is I kept on getting that vaccine and there was no reaction. That's a problem. So I think that just needs to be clarified.
Thank you, Dr. Ashraf. Dr. Faisal, I might come to you with this question. Why should people who have recovered from COVID-19 take the vaccine if they have already got the antibodies and experienced the immune response?
Sure, brother. So look, it's a really good question. So unfortunately, as of yet, we have not been found, the immunity that you normally would get from an infection is not long lasting. It also depends the severity of the infection. So if you do have a mild COVID, your immune lasting would be lower, as opposed to if you have a severe COVID ending up in ICU, mechanical ventilation, all those kind of things. Even though the worst case scenario, if you recovered and survive, your immune lasting has not been, it doesn't look like it goes beyond few months. All right. And the titer, there's in terms of immunity, you do have to maintain, you might have some sort of immunity, but not good enough to fight with the viral infection. So it slowly declines over a period of time. Hence, you need a vaccine at some point to boost it up. And on the top of that, even though, the vaccine, yes, you do get a vaccine, what we're receiving currently, but looks like that, it probably would not give you lifelong immunity. Still same like, influenza, don't make it too complicated. So we get influenza vaccine every year, and we know the virus can mutate, it can do mutation, and the color of the virus can be changed. Hence, after having this initial vaccination, we likely would be receiving yearly or some sort of an regular frequency vaccination.
Dr. Ashraf, a question to you. So this is a question from a sister. Can one of the doctors please answer my question? I have an autoimmune disease, SLE, and nephritis of the kidney, and I'm on many medications such as methotrexate and prednisone, and I also have blood clots and arthritis. Is the vaccine safe for me?
I mean, from the perspective of looking at it and saying, oh my goodness, you seem to have a lot of chronic problems, you would assume someone with arthritis and the various other medical problems that you are at higher risk of getting sick with COVID than the actual vaccine. Can I just, look, the vaccine, I wish the vaccine was more, we're talking about it, it's more than, we're giving the vaccine more credit than it's due. It's only the best it's the best possible answer. It only lasts in your body a few days and then it's gone. It's just a challenge to your immune system. If you're on prednisolone, you're on methotrexate, you're on so many other things, your body is constantly being challenged. The problem is that your immune system is actually lower. The issue you'll have is that even after the two injections, you may not be able to bring your immune system up enough to bring an antibody response. You may not seroconvert. So I think this is the classic example of someone that is actually sick. Not only should you be vaccinated, you're probably going to need to have continual vaccinations. This is this question why it's like, look, if your immune system actually is quite low and it doesn't actually respond, it doesn't actually stand up and make a good defense, we're going to have to challenge you again. Then you have to challenge you again. Or, so that I think is a very important concept, because unfortunately, it's all down to your own immune system. That's why that's the beauty. And can I just say one other thing that perhaps has anyone thought about how beautiful the actual COVID-19, this virus, how magnificent it is? I mean, Allah subhanahu wa ta'ala, it is the creativity of it. It continues to mutate. It can't live in dead cells. It has to stay in live cells. And so it's continually aiming to carry on. The beauty is that it doesn't actually kill so many people. It just keeps on being spread and it's so infectious to just continue to live on. It's just a fascinating creation. And I think it's one of those things for us to be reminded of the magnificence of the Creator. You know, that magnificence of Allah subhanahu wa ta'ala to create a fitna, but it's amazing, and to utilize the amazingness of our immune system.
Jazakallah khair. Dr. Abdul Latif, I want to come to you as the first person to give your concluding thoughts. So you've been, let's just quickly reflect a little bit with you. You've been on the front lines there in Melbourne at the vaccination hubs. Reflect to us a little bit on your experience there, what you've seen, the changes in Melbourne from a more macro perspective in terms of, what vaccination is potentially allowing Melbourne to see of a more permanent response to this. And what's your advice to the Muslim community generally, especially obviously in Sydney, where many of our constituents are based, but beyond as well, because we've got people watching from everywhere. Tell us your perspective on the whole from your experience in the last few months.
So on a public health level, I think the best way to describe this is as a miracle, considering the sort of destruction that coronavirus has wrought on Earth, developing and developed countries, to see how this vaccine works, and just to see the numbers drop off in the big countries like the US, across Europe. It's nothing short of a miracle. And unfortunately, due to factors beyond our control, Australia still hasn't seen that level of protection, but we will in coming months. And I beg the Muslims of Melbourne and of Sydney, do not deprive yourselves and your families of this protection. There's an opportunity to, criticize government. There's an opportunity to go after the media on plenty of issues, on plenty of topics. Trust me, they'll give us plenty to work with. But on this issue of public health, we are vulnerable, and our community needs to engage with opportunity before it. In Sydney, you guys have it significantly worse than we do at the moment, and I especially urge the Muslims of Sydney to get vaccinated, to follow the rules as much as they can, and to protect themselves and their families. Your life is an amana that Allah subhanahu wa ta'ala gave you. Your community and your city and your country, you owe them a debt, and that debt can be fulfilled by getting yourself vaccinated and following the rules. And ask Allah subhanahu wa ta'ala to lift this fitna of the people of Sydney and us in Melbourne as well. And inshallah, just a couple of weeks, couple of months, we'll be able to live relatively normal lives.
Jazakallah khair, Dr. Abdul Latif, for your time today. Dr. Faisal, some final thoughts from you, please.
So first of all, I think the LMA deserves some credit on this matter, especially for the Muslim community, and I'm really, really impressed and that you guys have taken some initiative. And I would urge other, the Muslim societal organization of, all over Australia to come forward. The picture that we're seeing in the hospital is different than the picture that you guys are seeing in the community. All right. The hospitals I'm working now, they're full. We are at the capacity. We're expanding our services. We're recruiting people. We're looking for more doctors. People are scared to, come and work for us because this is not the good time to work as a locum. So, and we probably, trying our best to tackle, but we need your help. We need the help from the community. And we are at hospital. We work hard to fight the battle, but from your end, you need to take all the precaution, that all distancing, mask, etc., isolation, etc. But more importantly, the vaccination is the solution, is a scientific solution of a pandemic. There is no other alternative, and this is the best option for us as available at this point in time. Let's think about UK. All right, I was talking to my friend early January. They were having the case of 60K, and they are dying people, in hundreds. But now they are having probably, not a big difference. They're still having 40K, 50K case a day, but they come out of, so lockdown. So we need to look at the bigger picture. Yes, we have been lucky, and we like to be lucky. All right, and vaccination is the only solution to move forward. Thank you.
Thank you, Doctor. Dr. Ashraf, final thoughts?
So I think for me, I think it's one of the most important things I just wanted to clarify, and I think we were talking to this before. In my mind, there are three parts that I think have just become coalesced together. One is this sort of anti-government sentiment, and you've got people, especially people that are anti-government, and I understand completely as a Muslim. I completely understand that there's all sorts of issues going on there. Then there's a second issue, which is to do with the lockdown and encroaching on our freedoms. Again, I get it. Both of these issues, I feel exactly what everyone else feels. But please do not put the vaccine on the same script as the lockdown and the anti-protest and anti-government. You can't link them all together because you're anti-government and you don't like the lockdowns, therefore I won't take a vaccine. Separate them. We're taught that in Islam. Quran and Mubin, we're taught in order to make things clear, we tend to want to separate them from Mubin, to try to separate. Then once they're separated, you can figure things out. Please separate your idea from of the vaccine from whether you like lockdown or not, or whether or not you support the government or not. Those three things should be separate. I'm more than happy for someone to hate the government, hate the lockdown, go get the vaccine. That's the way you should roll.
Thank you very much, Doctor. And finally, I think Dr. Fatima, are you there with us still? I think Dr. Fatima may have dropped off, unfortunately. So, Dr. Fariha, you'll be the lucky last. Please do share your final and closing thoughts with us, inshallah.
Thank you, Brother Faraz. I just want to mention that the vaccination rates in Australia are improving. I think we currently have about 16% of the population that are fully vaccinated. So they've had 2 doses of either the Pfizer or the AstraZeneca vaccine. And then we've got about 33% that have had 1 dose. So we are making headway with the vaccines, which is really promising. So the majority of Australians do see vaccination as an important way of moving forward. I do want to also mention something on social distancing measures. They are absolutely essential, and the majority of people are doing the right things. They have, however, caused significant amounts of stress for people. We've had separation from loved ones. We've lost some of our freedom. We've had uncertainty about the progression of the disease. There's feelings of helplessness. There's increased rates of domestic violence, increased risk of suicide, mental illness, financial instability, loss of employment, the loss of secure housing. These are issues that I see in my surgery, and I'm sure my colleagues on the panel today and all the other doctors out there who've all contributed to this session, actually, because a lot of the things we've mentioned, we're reflecting on our conversations with our colleagues. Doctors locally, doctors interstate, and even doctors overseas, all communicating. So thank you to those doctors that have also given us that information to share with the community today. This list goes on. Our best chance of returning to some normality is to minimise the harm of COVID-19 infection. And as my colleagues have mentioned, that's by developing immunity through vaccination. I also do want to mention, to community members out there who are suffering from any crisis, psychological illness, remember that there are a lot of free, confidential services that you can access, like Beyond Blue, Lifeline. There's a kids helpline, New South Wales mental health line. In Sydney, we have Mission of Hope, who runs Hayat Line, which is a very good service. They don't only service the Muslim community, but also the non-Muslim community and many more. For any of those of you who need contacts, please feel free to contact any of us. And finally, I'd like to thank the panel members today. It's the first time I actually meet any of the panel members. It's absolutely humbling to be here tonight. And Brother Faraz, of course, for moderating the session. And finally, the LMA for putting this together. I think it's been really good. We can agree to disagree on some issues, but in the end, I'm certain that we all want the same endpoint. We want less COVID, less deaths, and we want to go back to normality. And also Brother Ahmed Malas, who's worked really hard to put this together, and his team. So thank you very much. Jazakallah khairan.
Jazakallah khair, Dr. Fariha, and very much echo those thoughts from our good doctor. Thank you very much to all of our panelists. Jazakumullahu khair, and thank you for taking out your evenings with your families and joining us for this, on such short notice. It's very humbling that everyone is able to come together. And after thanking the doctors, I'd like to thank also definitely Brother Ahmed and the LMA for putting this on. It's been a fantastic initiative on the LMA's part. So, well done for bringing an important conversation together, hopefully one of a series and not on its own, but you'll see and hear more about that, inshallah. And finally, to all of our brothers and sisters and friends and elders from the community who have joined in, the response on Facebook has been pretty incredible, actually. We've had 300 plus people watching live, got almost 1,000 comments, perhaps expectedly. Not all of them agreeing with what we're saying, but that's okay. And a lot of people have asked very, very genuine questions and have seen the strength of the responses and are acknowledging that. We're getting a lot of messages to that end. So we're glad and humbled that you feel that way and that you've benefited from what's been said tonight. Thank you again for all of you for joining in. Thank you to the doctors and to the LMA and Brother Ahmed. We'll end it there, inshallah, on that note. And we look forward to being in touch with you again soon. Subhanak Allahumma wa bihamdik wa nashhadu an la ilaha illa anta astaghfiruka wa natubu ilayk. Wal 'asr innal insana lafi khusr illa alladhina amanu wa 'amilu s-salihat wa tawasaw bil haqqi wa tawasaw bis sabr. Assalamu alaykum wa rahmatullahi wa barakatuh.
Alaikum assalam.